were supposed to open up the pericardial cavity. So there it is, pericardial cavity with the heart sitting in it. And heart. Okay, got that. Just like there's the serosa lining the pleuroperitoneal cavity, we have a serous membrane here as well. And if I touch the outside of the heart, that would be the visceral pericardium. If I touch the inside lining of the pericardial cavity here, that would be the parietal pericardium. Okay, so that's the distinction made there. The transverse septum actually can be seen very nicely here. It's this partition that runs across the body here and separates the pericardial cavity from the pleuroperitoneal cavity. So this partition right here.
It looked really good before, isn't it?
I'm sure it did.
Yeah, it's very thin.
Yeah. So that's the transverse septum. And we'll see in a moment that that's, a moment meaning next lab, that's important for the vascular system because that's where the common cardinal veins run through to enter the heart from the anterior and posterior cardinals. On the peritoneal canal, I'm not going to bother with. It's hard to find, but it is an opening between these two parts of the body cavity. All right. So that's it for the digestive stuff. Then we have the respiratory stuff, the oral cavity, pharynx, and respiratory organs. And so hopefully your shark got opened up something like this. And you can see there's an oral cavity and a pharynx. And it's hard to figure out exactly where the boundary is, but the spiracles should be approximately at the boundary between oral cavity and pharynx. So pharynx behind, oral cavity in front. Okay. Primary tongue. So if you feel on the floor of the mouth of the shark, there's this thing here. You see that? And that's called the primary tongue. And it's hard. There's cartilages in there, and that's all the bases, bases of the visceral arches. So the basobranchials and basiohyal, serratohyal, all that stuff sits in here. And it's called a primary tongue because there's not a fleshy part that can move like with our tongue. And fish, that's what fishes have in general. It's a primary tongue. The secondary tongue, the fleshy tongue, develops in tetrapods. Okay. So you see that all right? Yeah. So it does sort of look like it has a tongue. Spiracle, you all know what a spiracle is. Internal gill slits, you probably saw them. There they are. And the internal gill slits are guarded by these little finger-like processes, and those are called the gill rakers. And those basically act like a fence and just keep things from escaping out of the pharynx while the shark's trying to swallow them. Branchial pouch. Okay, so the branchial pouch is this whole space that's been opened up by cutting open the pharyngeal wall. That's a one branchial pouch. This is another branchial pouch. Here, branchial pouch, another branchial pouch. Okay. And if we look within the branchial pouch, you can see the gills and the gill lamellae there, gills and gill lamellae. And then there's a region that has no lamellae that's out to the side, and that space has a special name. That's the parabranchial chamber, this area that's outside of where the gills are. You see that? Okay. And that's important because the sharks have the ability to create a negative pressure in that area to pull water across the gills, even when the gill slits are closed and the mouth is open. And that allows them to keep a one-way flow of water over the gills all the time, whether their mouth is open or closed and their gill slits are open or closed.
How like nurse sharks stay still and still keep water moving?
Exactly, yeah. I mean, there are sharks that do use ram ventilation, is kind of what we were thinking about, where they're actually just swimming and keeping their mouths open all the time and getting water in the mouth and out across the gills. But most sharks are actually pumping the water in and out across the gills. Okay, branchial pouch, parabranchial chamber, external gill slits. I think you kind of got that one. Interbranchial septum is kind of a funny term. Basically, it refers to this whole flap of tissue between one branchial pouch and the next. So here and here are the pouches. This whole thing is the septum, a partition between them. So again, this whole thing here is that septum. Right there. Okay. So it's a useful term. A septum is a partition, like the nasal septum separates the two nasal cavities. It's just a wall. Flap valve just refers to the little flap that covers over the external gill slit. That's the flap valve. Okay. Because it can open and close. The primary and secondary gill lamellae, basically when you look at the gills here, you see all these folds. Would those be the primary or secondary gill lamellae? These are the primary gill lamellae. The secondary gill lamellae are microscopic structures that run at right angles to those folds and are additional folds to additionally increase the surface area. So we're not seeing those. If we pulled this out and stuck it under a microscope, we might be able to see them. Okay. Holobranch and hemibranch is kind of a funny terminology, but it just refers to the fact that some of these interbranchial septa have gills on both sides of them. So that would be a holobranch if there's gills on both sides, here and here. However, if we look at this septum here, the very first one, right there, there's only a gill on this side and not on the other side. So that's a hemibranch. Okay. So one hemibranch and a bunch, 1, 2, 3, 4 holobranchs in the shark. Pseudobranch. We saw this already, but remember the shark, the shark on the outside has a spiracle, and there's this little flap valve in the spiracle.